All right, how are you all doing? How are you ladies doing tonight? I am mindful tonight of those of you who are on the East Coast, or at least in Florida, and thoughts and prayers go out to those of you who have, well, out there from the previous hurricane. And I mean, hopefully everything's okay and you can stay safe. Um, and so while we're waiting for everyone to get on, I will go ahead and say my disclaimer as I usually do. And anything that I say during this Wellness Wednesday tonight it is not health advice. It should only be taken as health information. Please do not start taking or stop taking or change the way you take any of your medications. If you feel you need to do so, please first get with your prescribing practitioner to help you make those adjustments safely. And of course, by attending this Wellness Wednesday, it does not establish a doctor-patient relationship. This topic that I'm going to get to tonight in just a moment, of sleep hygiene, has far-reaching effects, because I'm going to explain to you tonight why it's so important that we do get good sleep. I'm not going to go into necessarily the causes of poor sleep. That would be a whole different topic. But we are going to talk about sleep and the importance of sleep hygiene. So, and okay, I think everybody should be able to hear me and see me okay, right? I think so. I think we're good to go. All right. And so insomnia and sleep issues are such common symptoms of thyroid issues and blood sugar issues, for that matter. And I get asked about sleep a lot. This is definitely one of the pillars of health, is getting good sleep. And to start out, we're just going to discuss the relevancy of of getting good sleep and what sleep hygiene is. Stress is an important component, which I have discussed deeper in other Wellness Wednesdays, but certainly would be able to revisit that topic at some point. And a lot of what we do with sleep hygiene helps us to, in some way as well, de-stress. And so what is sleep hygiene? Sleep hygiene is essentially a set of healthy habits and environmental factors that can help you get better sleep. Poor sleep hygiene can definitely have a negative impact on your sleep quality and duration. It may lead to mental and physical health issues. And some, but not all, of the potential problems resulting from poor sleep include, I'm just going to go into these in a little detail. Certainly depression, anxiety, other mental illnesses. It can definitely cause mood swings, irritability, and paranoia even. So poor sleep is associated with heart disease, along with that, stroke, high blood pressure, diabetes, and certainly obesity. It can weaken the immune system, making it harder to fight off illness as well. Poor sleep can make it difficult to stay focused, to learn and remember things. I remember what a challenge that was during college, and always had to adopt different ways of learning, but it was sometimes very difficult because of the lack of sleep. And I definitely recognized that things were easier if I made a better habit of getting more sleep. It can also slow down the, processing speed and impair balance and coordination. So there are physical effects. So this can lead to safety issues, including while driving. Now, poor sleep can affect us socially too. Studies show that poor sleep can make it difficult to judge others' emotions and reactions. Isn't that interesting? It can also make people feel, uh, frustrated, cranky, or worried in social situations. Poor sleep can also age the brain. Studies show that this is true, that poor sleep can age the brain 3 to 5 years. And it can also lead, so meaning it can really make you function as if you are 3 to 5 years older. And there are changes in the brain that happen with age, but they should not be memory or focus related. This has to do with actual brain size, all right, where the brain actually shows a volume loss commensurate with age. There are a lot of studies showing that. It can also lead to a buildup of toxic amyloid proteins in the brain that are related to Alzheimer's disease. Now, poor sleep can increase cravings for sweet, salty, and savory foods. It can also, because it affects blood sugar and adrenal function, so blood sugar with sweet cravings, salty and savory foods for adrenal dysfunction. Isn't that interesting? And it can also lower levels of the appetite control hormone leptin, which can lead to weight gain and trouble regulating blood sugar. So poor sleep definitely predisposes a person to weight gain. Okay, so sleep hygiene is all about creating the best, most conducive environment in your bedroom for optimal relaxation so you can get optimal sleep. Okay, now there are several tips in a few areas I will now share that have been shown to help in many cases, though they aren't all super rigid, and you just need to adapt them to your circumstances and form your own habits and bedtime practices to sleep the best. So the first thing is setting your sleep schedule. Okay, have a set schedule. Having a set schedule helps you to normalize sleep as an essential part of your day and gets your brain and body accustomed to getting a full amount of sleep that you need. I have often heard, even from my own children, the more sleep they try to get, if they do end up getting more sleep, because typically teenagers lack sleep, they don't get enough, they're up late doing something, homework, and they don't like to go to bed, and then they have to get up early. Well, when they do get a little more sleep, they're more tired during the day. So it's interesting how we become accustomed to getting a certain amount of sleep. And along with that sleep schedule, you need to have a fixed wake up time, regardless of whether it's a weekend, right, or a holiday. Try to wake up the same time, since a fluctuating schedule keeps you from getting into a rhythm of consistent sleep. It's about training your brain. Okay. All right. We've got to prioritize sleep. It might be tempting to skip sleep in order to work, to get something done for work, to study. Certainly, I was guilty of that during school and medical school. In order to socialize or exercise. But it is vital to treat sleep as a priority. Calculate a target bedtime based on your fixed wake-up time and do your best to be ready for bed around that time each and every night. And I alluded to this before, but making gradual adjustments is more important than really making drastic shifts to your sleep schedule. So if you want to shift your sleep times, don't try to do it in one fell swoop, because that can throw your schedule out of whack. Instead, make small step-by-step changes so that you can get adjusted and settle into a new schedule. I often recommend that you make 5 to 10 minute increments is all. All right. And do make sure to make those 5 to 10 minute increments happen for about a week. And then the next week, go another 5 or 10 minute in another 5 or 10 minute increment, and so forth. Do try not to nap, and if you must, because sometimes just laying down and resting your eyes for a few minutes is helpful and rejuvenating, but do so if you must do so. Do this early in the afternoon for a relatively short time. Like I said, about 10, maybe no more than 20 minutes. Some people like to call that a power nap. And so that's where that comes from. It's important to follow a nightly routine. How you prepare for bed can determine how easily you'll be able to fall asleep. A pre-sleep plan or agenda, including some of the tips, these tips that I'm going to be talking about, can put you at ease and make it easier to get to sleep when you want to. And keeping your routine consistent is so important. Following the same steps each night, including things like when you put on your pajamas and brush your teeth, and this can reinforce in your mind that it's bedtime. You need to budget 30 minutes for winding down. This may be a new concept for some of you. Take advantage of whatever puts you in a state of calm, such as with soft music, classical music, light stretching, reading. But I would say not reading something super stimulating, like a Tom Grisham novel or a Dave Patterson novel, nothing like that. And then maybe doing a relaxation technique or exercise. And there are oodles of those all over the internet. You might consider dimming your lights. Try to keep away from bright lights because they can hinder the production of melatonin. So blue light and bright light can hinder the production of melatonin. This is a hormone that your body creates to facilitate sleep. Try to unplug from electronics. But Dr. Redd, that's so difficult. I hear that all the time. Like, it's almost as if I'm, suggesting that you stop breathing. Build in a 30 to 60 minute pre-bed buffer time that is device-free. Okay, cell phones, tablets, computers, laptops cause mental stimulation that is hard to shut off, and also generate blue light that may decrease melatonin production. So I guess you could cheat and wear blue light glasses, or install blue light blocking software on your laptop. But it's best just to take a few minutes, at least 20, 30 minutes, at least, to unplug from electronics before going to bed. Now, it's important to test these methods of different methods of relaxation to find which might, resonate with you or fit with you better. So instead of making falling asleep your goal, it's often easier to focus on relaxation. So some forms of of relaxation include meditation, mindfulness, paced breathing, and other relaxation techniques like progressive muscle relaxation. These can put you in the right mindset for bed. Now, this is interesting to mention. Try to consciously avoid tossing and turning. It helps to have a healthy mental connection between being in bed and actually being asleep. So if for this reason, if after 20 minutes you haven't gotten to sleep, simply get up, stretch a little bit, read something uninteresting, do something else calming in low light before trying to fall asleep again. Okay. Now, it is also important to cultivate healthy daily habits. So habits that you form during the day also help with getting good sleep. Having positive routines during the day can support your circadian rhythm and certainly can limit sleep disruptions. One example that I would give you is make a habit of waking up to doing a meditation or a breathing exercise, or we often we give our patients, anyone that I accept as patients, heart math, inner balance devices. And I would encourage you to use that or do something like this every morning, because think about it. When you are having to wake up, you have to set your alarm early to catch a flight. How easy is it to get a good night's sleep that night? But when you're going to wake up to something pleasant, something relaxing, that can certainly still get you going, because there are some wonderful breathing techniques for increasing your energy when you get out of bed. One of my favorite apps is called Insight Timer, and there are some nice free meditations, free breathing exercises on that app, geared especially for kind of energizing yourself when you need to do that. So it's also important to get daylight exposure. Get outside, get some sunlight. It's one of the key drivers of circadian rhythms that can encourage quality sleep. So get out in the sunlight for even a few minutes if you can. And I'm not a very good example of this. I should take more time during midday and just get outside and do a short walk around the complex, the business complex where my clinic is. But if you can do something like that, that is really helpful. Be physically active when it's deemed correct or right for you to exercise, because you really should have individual guidance on that. This is something we guide each of our patients in, because for most of our patients, it's not really conducive or productive. It may be counterproductive, in fact, to their healing process to exercise. But if you're at that point where you can, getting regular exercise, at least stretching, those of our patients who they may not be able to get out and do something more strenuous, but maybe stretching would be a very healthy thing to do every day. And that can deliver a host of other health benefits too, not just make it easier to sleep at night. I know this doesn't pertain to most of you, but don't smoke. Nicotine stimulates the body in ways that disrupt sleep. This can explain why smoking is correlated with numerous sleeping problems. Reducing alcohol consumption is very important with sleep concerns. Alcohol may make it easier to fall asleep, but the effect wears off, disrupting the sleep later in the night. You will likely wake up earlier than you're used to, And it's just, as a result, it's best to moderate alcohol consumption and avoid it later in the evening. Cutting down on caffeine in the afternoon and evening can also help. Because it's a stimulant, caffeine can keep you wired even when you want to rest. So try to avoid it later in the day. Now, I know there are some of you who say, but Dr. Redd, caffeine actually helps me go to sleep, which it's interesting. It can be true for some people. That's why these don't apply to everyone. And you might notice that the stimulation that caffeine causes can help the ADD in you to calm, and you can then focus more on relaxing your body. And for some people, it actually helps. So I know that sounds so funny, but we're all different. Also be aware that, if you're the type of person that this really does affect, just consuming lots of caffeine, to try to make up for the lack of sleep, you get into trouble with that vicious cycle. All right, so don't dine late. Eating dinner late, especially if it's, big, heavy, spicy meal, can mean you're still digesting when it's time for bed. In general, any food or snacks before bed should be on the lighter side. Furthermore, the later you eat, the more insulin you produce from the pancreas, because it's the way your circadian rhythm works, and you're getting ready. Your body knows that you should be getting ready to, with your 24-hour clock, you should be getting ready to go to bed and get some sleep. And it's going to help get that, it'll help store that excess blood sugar more as fat than it will be to store it in, your other tissues. There are, studies show that later dinner times contribute to worsening insulin resistance and development of diabetes. Now, this one is fun. Restrict in-bed activity. So you want to encourage the connection in your brain between sleep and being in bed. Okay. It's best to only use your bed for sleep. But I say there's only two things you should do in bed, and that's sleep and sex. So apart from the latter, try to only use your bed for sleep. Okay. Don't sit in there, with your laptop. Especially don't use your phone in bed. And I know some people in my family are going to be upset at me probably for bringing this up, but you just want to avoid using electronics or doing anything other than trying to go to sleep in bed. Okay. Make your bedroom your relaxation sanctuary. That's kind of the point with all this. Your sleep environment is as important as creating these sleep hygiene habits. To fall asleep more easily, you want your bedroom to be inviting and a place of calm and tranquility and free from disruptions. You also want to have a comfortable mattress and pillow. I mean, some of these may be pretty obvious, right? Your sleeping surface is critical to your comfort and a pain-free sleep. So choose the best mattress and best pillow for your needs wisely. If your mattress is over 5 to 7 years old, it's probably time for a new one. All right. Even if you have a fancy, Tempur-Pedic one, it may be smart to replace that sooner than what they tell you. Or they may tell you to replace it sooner, and you're like, well, yeah, that's just a sales tactic. these materials break down and they change a lot over time. So it's very important, like I said, to maintain the comfort of your mattress and not allow it to get too old where it starts to, be less supportive and less comfortable. When you notice that it's just getting uncomfortable, it's probably past the time that you needed to replace it. And you might even consider the bedding that you use. So some of you might do it's the first thing you touch when you get a bed. Some of you might do better with, like cotton. Some of you might do better with flannel. Some with, more silky sheets. Because, you may want to feel the coolness and we're going to talk about temperature in a minute. So it's beneficial to make sure that even your sheets and bedding and blankets match your needs and your preferences. It's funny, I have one of my sisters, because I used to, I used to babysit her kids. I a lot younger, kind of part of my parents' second family, and I would babysit a lot, and I would go into their bedroom when we were, I was watching their kids, and there were always two sets of blankets and probably sheets on either side of the bed. And so one day I asked, like, what is going on with your bed? Why are there two different, you know, because they like different types of bedding, and they were very sensitive, I guess, to the other pulling the other bedding off of them. I guess they learned this early on in their marriage. I don't know. So I mean, do what you can to make your sleeping environment comfortable. Um, it's important to have cool but comfortable temperatures in your room as well, usually erring on the side of, the cooler side, typically around 65 degrees Fahrenheit. Um, just depending on your preferences, is usually more conducive to deeper sleep. Okay. I think you ladies know that when you get those hot flashes, it's hard to sleep. So heat never really does help help us get a good night's sleep. And that's often why we wake, is because it's too hot. And it is important to block out light to prevent light from disrupting your sleep. Use heavy curtains or even an eye mask. Drowning out noise is sometimes important, especially if your spouse is a loud snorer. Earplugs can help. And if they're not comfortable, then you can try white noise. You can, I recommend putting your phone in another room anyway, but if you need some white noise, there are certainly several things on the internet that you can download to play 8 hours of white noise, or use a fan, which would probably be better than keeping your phone by your bedside table. And then the last thing I would mention is trying calming scents. So light smells, like lavender, may help to calm the mind and create a positive space for sleep. Okay. All right. So these principles of sleep hygiene apply to nearly everyone, but not necessarily. And I would recommend testing out different adjustments that I have explained to find out what helps the most for you to get better sleep. But you don't have to try all of them at once. Our brains need a more gradual approach as well. Remember that. Just an example today, I was talking to Terry, who suffered with insomnia, and she now sleeps through the night very well. She has implemented a lot of sleep hygiene practices and certainly has fixed her thyroid issues and has been successful in helping her blood sugar issues to resolve. So she's sleeping well and feeling rested in the mornings. And I also spoke with Hannah recently, who is one whose stress really kept her awake. It was a big deal for her, and she would fall asleep and then wake up often during the night. And then she began testing some of these, recommendations and started to sleep gradually better, longer. And so we know these can be very, very helpful, adjustments and habits. And I would encourage you to take these recommendations. You can always go back and listen to the replay of this so that you can remember various things that we talked about tonight. Sleep hygiene won't solve all sleeping problems. There are many root causes for poor sleep and insomnia. So on that topic, comprehensive testing is vitally important for figuring this out. This way you can figure out why you might be having poor sleep, because if you have a thyroid issue, if you have a blood sugar issue, these are very, very common reasons for why you're not sleeping well. Poor sleep is so common. And for most of our patients, they find their sleep improves, sometimes very significantly. So ladies, you don't have to continue with poor sleep. You can take more control of the situation than maybe you knew. Maybe you can take definitely more control than you maybe knew before tonight. So have hope. There are answers. Now, I wasn't planning to take questions tonight, but if you do have questions, please post them in the comment section below the video. And being that it's Wednesday night, I will try my best to get to them in the next couple of days. And so be watching for, if you asked a question, be watching for the reply with your answer. So yes, ladies, have hope. There are answers, and you still have the power to heal. Thanks for joining me for this Wellness Wednesday. Have a great rest of your evening and a great rest of your week. And I'll see you soon.